Hello, welcome back to the channel. Today's question is from the musculoskeletal section. A 64-year-old woman comes to the office with complaints of numbness and painful tingling in her left hand. She first noticed these symptoms about 4 months ago. At the beginning, the numbness and tingling only occurred after long periods of quilting, but more recently the symptoms have started happening at night, sometimes even waking her from sleep. Running warm water over her hands usually provides some relief. Her past medical history includes hypertension, obesity, and degenerative knee arthritis. She is retired and left-hand dominant. On physical exam, you find diminished sensation in the palmar aspects of the left thumb, index finger, and middle finger. Sensation is normal in the rest of the hand. Strength and muscle bulk are symmetric between the two hands. What is the most appropriate next step in management for this patient's condition? A. Non-steroidal anti-inflammatory drugs. B. Oral corticosteroids. C. Pregabalin therapy. D. Surgical decompression. E. Wrist splinting. Pause the video here and think about your answer. If you chose E. Wrist splinting, then that's correct. Carpal tunnel syndrome is caused by compression of the median nerve at the wrist. Risk factors include obesity, pregnancy, diabetes, hypothyroidism, rheumatoid arthritis, and patients on long-term dialysis. Clinical features: pain and paresthesia in the thumb, index, middle, and half of the ring finger. It's often worse at night. On exam, Phelan's, Tinel's, or Durkin's test may be positive. In severe cases, you can see weakness of thumb abduction, opposition, and atrophy of the thenar muscles. The confirmatory test is in nerve conduction studies. Treatment: start with wrist splinting. Glucocorticoid injections can be used if symptoms persist, and surgery is reserved for severe or refractory cases.
In carpal tunnel syndrome, oral corticosteroids can help, but they're less effective than injections and carry more side effects. NSAIDs are commonly used, but they don't actually provide much benefit. Pregabalin is usually for other nerve pain, and in carpal tunnel, it's only considered if splinting fails and surgery isn't possible. Surgery is very effective, but it's reserved for moderate to severe cases that don't improve with conservative treatment. So the best first step is wrist splinting.